Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Now we will look into what is the reason for H3N2 influenza. Basically, this is a seasonal flu. Seasonal flu means you will get across the year, but in Western countries you will get only in some season, that is cold season. But in India we will get across the year. Why is it coming mainly at this stage? So we have undergone the pandemic of COVID. We are not exposed. We were very clean, we were very neat, there were no exposure to any pathogen for the last 3 years. So we lost the antibodies within our blood for this virus. That is the reason the attack is bit severe now. And also there is vaccine for influenza virus since 2009. It is available, but we were not taking it regularly. These are the three main reasons for the increase in the attack of this virus. Now we will look into the pathology of the virus in the sense how the virus enters into the body, how it replicates, how it damages the human body. We will deeply look into it. This might be a mutation in the virus. So because we have not undergone through this infection for 3 to 4 for last 3 years, this might be a mutation. The incubation period for this virus is 1 to 2 days. The moment the virus enters into your body and the time it will take to show the symptoms is 1 to 2 days, that we call as incubation period. This virus is very fast spreading through aerosols and droplets. Aerosols, when we sneeze, when we cough, when we let out our sputum into the air, there will be small drops which will be suspended in the air. Those we will call as aerosols. And a little bigger drops that we call as droplets, they will not be suspended in the air, they will be dropping onto the floor or dropping onto the surface. So when other human beings come into contact with these surfaces and they inhale or they touch their mucosa, the virus enters into their body. After the virus enters into the body, these virus have receptors on the upper respiratory tract. Upper respiratory tract includes nose, pharynx, and trachea and mouth. Anywhere these virus enters into your body through this mucosa, this virus enters into the cell and starts replicating there, and it will increase its number there. Once it increases its number there, it will try to damage all the cells of the lungs and other parts of the lungs. So primarily what happens is this will produce, in some severe cases it will produce primary pneumonia. Primary pneumonia means the pneumonia that is occurred through virus. This will have breathing difficulty. It may reduce the oxygen saturation levels. When it goes beyond 1 to 3 weeks, what happens is secondary pneumonia by bacteria may cause after 1 to 3 weeks. It is very highly risky in the patients with heart attack.